technology company Royal Philips to establish a partnership platform for transforming primary healthcare as offered around the country. Now, and to, well, give us additional detail on what exactly this deal was and what this meant, we have with us in studio Roelof Assies. He is the CEO of Philips East Africa. Well, karibu sana to studio.
Thank you very much.
Yeah, first off, of course, we can see a lot of, well, so to say, paraphernalia here on the table, but just give us a bit of background, especially against the background of the Sustainable Development Goals.
Correct.
And the promises that that has towards universal health care for people, not just here in Kenya, but right across the world, and what your organization, the UN and the Kenya government have been trying to do around that.
Good, thanks, Peter.
Yes.
Thanks for having me over here. It is very important to make sure that what you see in the SDG 3 specifically is to create health for all. And I think that's very important. So if you want to create health for all, you really have to create also health for everybody in the country, not only for the wealthy people, but also for the people really who need it, especially in the rural areas of Kenya. So together with our company, together we have been researching specifically what are the needs in the community, what are the needs in the country when it comes to primary health care. Philips has been establishing a research center over here in Nairobi, which is not only serving Kenya, but actually the total of Africa, and really understanding the needs of the community when it comes to health. And interesting is that health is also having an impact on safety, for example. Health has an impact on the well-being of a person. You talked earlier about safety in the country, the kind of things. These are very pertinent kind of things which are important. So we have been putting up a community life center, as we call it, in Kiambu County to really understand the impact of such an healthcare basis on the primary healthcare side. And that has proven to be so successful that we have been talking to the various stakeholders like United Nations, like the Kenya government, but also many other stakeholders like the Dutch government, etc., to really set up a platform to really make a drastic change into primary healthcare.
Yes.
We as a company are very high on technology when it comes to tertiary level. So we have been partnering with the Kenya government, for example, on rolling out the MES project as well, providing intensive care units to Kenya. But that is very important. What's also important to bring that to the level where it is most needed.
Yes, so and just to cut you off right there, because you said you're doing research, and for me this raises a pertinent question, because while it might seem a moot point to a lot of people, the fact that people's needs are diverse and different from other parts of the world, what have the findings been? Are there any really different needs here as compared to other places? Yeah.
So in addressing the challenges on the ground over there, we found a very interesting topics as well. Next to the availability of doctors, specialists, medicine, etc. One of the very key elements as well, which is necessary, is, for example, light and power, clean water, making sure that facility is safe, etc. So we created a holistic approach. That's why we also call it the Community Life Center, whereby we not only address the healthcare issues, but also the issues really making sure that everything works together. The holistic approach is important. A clinic cannot work when you don't have power. A clinic cannot work if you don't have clean water. So that part of it is very important. So we make sure that all the elements are ticking the box. So providing solar power, making sure that you have a borehole which keeps working, making sure that connectivity is there, so that in rural areas you also have the connectivity. And there are many providers in the country providing fantastic coverage in the country as well, to make sure that you understand what's happening on the ground in rural areas. So connectivity is important, understanding the needs over there, and I think that is next to what is there is very important. And just another element next to power and water is also the need to adapt certain technologies to what is really needed. And I have a few examples in front of my table over here. And the left one is the baby over here. And the baby has a small device in front of his chest. One of the biggest killers in rural Africa is pneumonia in children. So pneumonia in children is really a big killer. So what do we need to do is to really make sure that we actually develop a device which is simple to use, very easy to understand, and to detect actually pneumonia on the child in a very early age. Pneumonia is treatable. Children do not have to die on pneumonia. So this device was developed together with the UNICEF.
To raise it a bit higher.
So like I think, so this device actually is so simple that you can actually, with a push on a button, understand within 1 minute if the child has pneumonia, yes or no.
And this would be available and affordable for people here in Kenya?
Yes.
Would we need to buy that for each and every child, or would that be accessed at the facility?
No, that will be accessed at the facility. So what is there is there are 2 versions, one with a battery operated one and one with a rechargeable battery.
Yes.
So it can be bought by clinics and by bigger hospitals to be used. It has a long lifetime. It's specifically designed for Africa. We tested it in Kenya. So the clinical testing was done over here. And now it's available for the world.
What are the success rates on this sort of technology? Because I know the investments are steep for Kenyans, so to say. And what can we expect that the payback will be?
No, I think one of the biggest problems in death and mortality at children is some of the diseases which are preventable. So the big effect will be that you detect those diseases early and really save lives. And I think that is the biggest effect you're going to have. Saving lives, making sure that the families do not suffer with the loss of their children, increasing their families substantially, which they have to cater for as well. So the families can go down in size, and you see that. And where health is improving, you see that the number of children being born is also reducing as well. So the impact over there economically is very steep as well. So the family becomes smaller, it's easy to maintain as well. You don't have to bring a lot of children up to the next levels. This is really saving lives. This is one example of it. Another example is the one which I have having here. Because one thing which is very important is to make sure that the woman, the mother who is actually carrying the child in the womb is staying healthy and making sure as well that the baby's been delivered in a safe way. So this is a fetal Doppler unit. And those are available in the bigger hospitals, in Nairobi, for example, Kisumu, Mombasa.
I'll going to raise it a bit higher.
But this one is specifically designed for the rural areas. So a device which is operating on batteries and actually has on the back a kind of wind-up device whereby you can wind up this unit and not using power. So this is the wind-up Doppler device whereby you can check the baby in the womb during the pregnancy of the
Again, what's the benefit for this?
Again, this is really not only saving the child, but it's also saving the mother. And the mother quite often being the cornerstone of the family, providing the food, taking care of the families as well. So if you save the mother, you really have a big benefit for the whole family in total. This is really saving lives as well. So 2 devices which are simple, which are affordable, which are specifically designed in Africa, for Africa, with our research hub over there. I think this is really what makes an impact, not only on the lives of people, but also on the economy of the country. Talk
to us about the bag, the fact that I can see it comes with a solar panel on the front.
So this is what we call the backpack. And this backpack is actually being used by the community health worker. So I talked about the community health center. The community health center needs people to go into the community to really address the challenges they have in their community. So this backpack is containing the device I just mentioned over here, but also devices which are there to monitor the vital signs of the patients, having a light device as well, and also devices which can be powered by the solar panel in front. So the solar panel is providing power for those devices which are in the backpack. This is used by the community health worker. And this is a very important thing. Community health worker are the key elements when it comes to addressing the key health at the community level. So rural areas, community, they provide the information via connected care towards the community life center and to the secondary level hospitals, either by mobile phone or via other devices as well. That really has a big impact in the community itself.
Let's talk a bit about the life centers themselves. And the question I feel like asking right now is, first, are these scalable? Can we grow them up? Can they be replicated in other places? You said you have one in Kiambu. Would we be able to put up this in a place like Marsabit, where penetration of healthcare and health services is still very low?
Very important question, and I think a very good question as well. That's exactly the same question we asked ourselves as well. So together with the United Nations, we have come up with a plan to build one, and actually we're doing it right now, in Mandera County, in a place called Dandu. A very remote area. And that is really proving what can be done in that remote area. That's where the challenges are the biggest. If you look at Mandera County itself, the mortality rate for mother and children is the highest by far, not only in Kenya, but the whole of Africa. And that impact over there will be greatly felt in those parts of the world itself. So Dandu, Mandera County, is the next rollout of our Community Life Center in Kenya.
Yes.
And like you said, the scalability is an important one. That's why we partner. The partnership between the United Nations, between the Kenya government, between other stakeholders like the Dutch government, etc., is crucial. We as Philips cannot do it alone.
Yes.
We need to have partners to make sure that they scale up, they bring together the funds to really bring these community life centers and the primary healthcare to the next level. You need financing for it. You need universal healthcare. That means also the insurance system has to be looked at.
Yes.
All the elements to ticking the box are important to be addressed in such a platform. Now, Philips is investing as the first private sector into this platform to really, because we as Philips believe that primary healthcare is the key to getting proper health for everybody.
Okay. Let's talk finally about the urban setting. The fact that for places like Nairobi, it's the sheer number of patients in need that sort of, so to say, overwhelm the major facilities. Can this then be rolled out in places that will enable the pressure to be taken off these facilities, and will they be effective?
It's a very, again, a good question. What is causing the overwhelming patient flow into bigger hospitals in Nairobi? Is actually that a lot of patients do not find the healthcare in rural areas.
Yes.
So what they do, they jump the queue, as we call it, instead of going to the community life center or the clinic they have or the hospital they have close by, they know they can't find it currently. So they're jumping and they're going to the bigger cities. So Kenyatta Hospital are being flooded with patients who do not need to go there. Kenyatta is actually needed to make sure that they treat the more difficult cases.
Yes.
They don't have to go via maternity areas and simple diseases which can be treated locally. And that's why we think strengthening the primary healthcare and secondary healthcare is important. The Kenya government has done a lot of efforts already on the secondary level.
Yes.
Yeah, but now it's also time for the primary level as well.
And things like nutrition, the environment, and indeed a whole host of other things and conditions which are not exactly health, but are health-related, part of this conversation. Is there a sort of a knowledge component to this to be able to make this as effective as it can be?
Yes, and that I think is again important as well. So part of the platform is also Unilever.
Yes.
So Unilever comes on board as well because they are important to make sure that other elements of health related things and the well-being of it,
yes.
Also the teaching element of it to make sure that people stay healthy, live healthy, living a healthy lifestyle as well, to make sure that this has been addressed. So the stakeholders are not only pure healthcare related stakeholders, also wellness related stakeholders to make sure that you have hygiene, that you have clean water, that you have healthy food, etc., to make sure that you don't only stay healthy now, but also in the future.
So when can we expect that these community life centers will be rolled out, apart from the one that's already up and running, so that the proof of the pudding is in the eating, so we can check it out ourselves?
Exactly, fully agree. So Kiambu is already running for about 2 years. The Dandu one will be officially commissioned in the middle of July. Yeah, so we are installing all the elements as we speak. So the commission will happen by that time.
Yes.
And we also rolled out in the DR Congo as well. And the next phase is now that we believe in the next 1 or 2 years, you're going to see a mass rollout throughout the country in Africa.
Okay. Indeed, thank you very